This is Hasna Hena Sara. I am currently working at BRAC, James Brigand School of Public Health, BRAC University in Bangladesh as a senior research associate. Today, I am going to present the study findings of informal child labor in Dhaka City, exploring the pull factors and health sufferings of children involved in waste management sector. So I'll try to share the key findings of the study and as well as the brief methodology, and finally some recommendation based on our study findings. So we all know about the global concern about child labor, that it exposes the labor issue that is intricately intertwined into the unequal society. So, and we all know about that global estimates show that 160 million children engaged in child labor at the beginning of 2020. And among them, 63 million are girls and 97 million are boys, accounting for the nearly 1/10 of the all children. And the magnitude of child labor is significantly greater in developing country, where 1 in every 4 children engaged in any kind of hazard occupation. So what about the scenario of Bangladesh? In Bangladesh, majority of the population living below the poverty line, and the low-income families are unable to provide enough care for their children. So child labors are very common and prominent features here. Young children serving at the roadside tea stores and selling goods to motorists are very common picture here. And according to the Child Labor Survey Bangladesh 2013, among 39.6 million child population, almost 3.45 million are working children. And children migrating to cities alone, and mostly due to the floods or other natural disaster or loss of land or jobs. And most of them are separated from their family. So, and then they are engaged in a wide variety of activities such as collecting paper, garbage collection, and carrying and lifting goods and begging. This is very common picture in Bangladesh actually. So in Dhaka City mainly, but though a lot of children involved in informally in the waste management sector in Bangladesh, unfortunately there is no data on child waste worker. So the objective of the study is to determine the socio-demographic characteristics of the children and track the pathways in getting involved in waste management sector. And then we also want to know the the knowledge and practice in collecting and sorting waste. Finally, we also want to determine the associated health sufferings, as well as to assess the effect of COVID-19 pandemic on their employment and daily life. So to achieve this objective, we followed, this study adopted an exploratory sequential mixed method research design. And our study population consists of the children aged 5 to 17 years and who involved in waste management sector. And for the qualitative data, we in-depth interview and key informant interview and focus group discussion were conducted with children and as well as some adult co-workers to know their situation and why they involved in waste management, and how the recruiter recruit these children in waste management sector. That's why we also conduct KII among the adult. And for the quantitative data, we followed a multi-stage cluster sampling. A complete list of children who involved in the waste management process was done during the initially, and then in the first stage of sampling, 50 secondary transfer stations were randomly selected from the 94 secondary transfer station. And in the second stage of sampling, respondents were selected proportionately from the STSs. We also try to collect some spatial data we utilize the OpenStreetMap data as a secondary data source, and also collect the GIS location of secondary transfer station. So I just want to share the brief overview on the study area as well as the waste management system of Dhaka City. Dhaka is the capital of Bangladesh, and It is referred to as a mega city, as more than 10 million people live here. So to facilitate the waste management service in the city, landfill and secondary transfer stations have been built by city corporation. And secondary transfer station is also known as a waste transfer station, is a location where waste are stored for a short period of time. Here in the picture, it shows the process of the system of waste management system in Dhaka. Actually, in the first picture, it shows that the waste are collected from the sources, that is from maybe from household or maybe from the shops or other industry, collected by the children, and after that they transport the waste towards the secondary transfer station. And in the secondary transfer station, the waste are temporarily stored for a short period, obviously. And in the last stage, they are transported to landfill through the city corporation truck. And in each stage, there is a important issue, that is informal recycling occurred in every stage by the waste collector or waste recycler, and where most of the children involved in this recycling. And this is one most important thing why the children wants to involved in waste management sector, because by informal recycling they can earn a lot of money actually, rather than their monthly salary. So this is the overview of Dhaka's waste management system. And here the next slide shows the map of the Dhaka city. And in the slide, the red circle denotes the secondary transfer station. There are 94 secondary transfer stations in Dhaka city. And I want to show the picture of secondary transfer station where children try to pull the van into the secondary transfer station. And the next one, this is the picture of a landfill. And the next one is a recycling zone where a lot of children involved in recycling, and obviously in informally. And for the data analysis purpose, we for the qualitative data, we utilize the NBView software. And for the quantitative data collection, we use Kobo Toolbox, and Spaces and Data software used for the analysis purpose. And for spatial data analysis, we also use the Kobo Toolbox and QGIS software. So now for ethical consideration, ethical approval for the conducting this research was obtained from the Institutional Review Board of Bragg James Brigand School of Public Health, Bragg University. And obviously written informed consent was obtained from all the adult respondents. Since this study included a lot of children actually, and for this purpose, informed consent was obtained from their parents, either parents or their guardian actually, and the assent from the respondent. So I would like to share the key findings of the study. And in the first, I want to share some socio-demographic characteristics of respondent. The study shows that most of the respondent of our study is below 15 years, and most are male. And on nearly 1/4 of the respondent did not enroll in any educational institution, that is and we also want to know the reason behind not enrolling any educational institution. So they mentioned that they could not afford schooling. Some almost 45% responded, and 34% responded they need to support their family financially, and 16% responded their family did not allow to go school actually. And we also want to know whether they want to start their school formal education again. Unfortunately, 71% of the respondents don't want to start their education. And we also want to know the pathways of getting involved in waste management sector. Here I am sharing the key findings from both quantitative and qualitative data analysis. So we found that family members' involvement is a major driving factor, and migration is another important factor why they migrate from the other district to capital, and they try to involve in any kind of job where that is accessible to them. So waste management is easy accessible job, and no training or experience required to this job. And obviously income is relatively high for the child waste worker in this sector. And we also want to know their opinion why they involved in this sector. 15 years old respondent mentioned that if you are the family's oldest son, you must to contribute to family financially, and I don't want to be a burden to my parents. That was his perception. And another respondent mentioned that this is what my grandpa did for 27 years, and I learned it for him. So my father and family members are also involved used to do it. So family member involvement is another factor, since their grandparents and parents involved with this profession, they from very early age, they also involved with waste management sector. And another respondent who mentioned that due to COVID-19, since the government announced that school would be closed for an unspecified amount of time, so he think about to migrate to Dhaka and search for a job, and he then joined in waste management sector. So we also want to know the pattern of migration, and the slide shows that this is interesting to show that most children migrate from 4 to 5 districts mainly, and these are we also want to know the reason behind this pattern actually. And we found that the district that is Borishal and Bhola, that is and almost and Sunamganj and Kishoreganj, they are vulnerable in terms of climate change, and also the employment opportunity is limited here. So children migrate alone or with their family in search of employment or in search of any other opportunity. So after that, we want to know the factors related to child workers or workplace. So most of the children, almost 83% of the respondent worked in the secondary transfer station, and they worked as a waste recycler, almost 80%, and 75% of the waste collector, and 40% work as a waste driver. These are multiple response. Some of them both working as a waste recycler and collector, and sometimes they are also working as a driver. They pull the van towards secondary transfer station. And so we also want to know the access to facilities in terms of working area. Unfortunately, almost 90% of the respondents mentioned that there is no facilities. I mean, no access to drinking water, no access to toilets, or any place for lunch, or to any place for eating. And here in the image, the first image shows that children collect waste from the household and then pulling the van towards the secondary transfer station. And the second image shows that inside the secondary transfer station, children work with their adult co-worker to separate the plastic waste from the collected household waste. And we then we want to know the knowledge about personal protective equipment and health safety. So almost 70% of the respondents know about personal protective equipment and health safety. They know they should wear masks and gloves while working, and they also know they should take a shower after working. And one of the respondents in our in-depth interview mentioned that yes, wearing mask is good habit, since it may lessen the odors that we were accustomed to on the insides of our bodies, which can be detrimental if they enter our bodies. So we the study shows that they are aware of the personal protective equipment and their health issues. But unfortunately, well, we want to know the practice about personal protective equipment. It's shocking actually that 90% of the respondents didn't use any protective equipment. And
just marking the time, there is like 3 to 5 minutes left for you to speak.
Okay, so 90% of the respondents also mentioned that they don't have any safety equipment and they didn't use any safety, any protective equipment. So one of the respondents mentioned that we don't wear these since the price is excessive and they don't wear long lasting. And another respondent mentioned that I can work while wearing gloves since it interferes with my natural workflow. And we also want to know the associated health sufferings among child waste workers. Due to the unhealthy and hazardous environment, children face various types of health problems. Most of the respondents mentioned that they have suffering from pain in shoulder and other parts of the body. Despite the risk, most of the children, almost 54% of the children thought that they were healthy. And we want to know about the musculoskeletal problem, and almost 60% of the respondents mentioned that they have pain in shoulder, and the study found that almost 54% had 4 or more musculoskeletal problems. And one of the respondents mentioned that when the waste basket is loaded fully, it weighs almost 30 kg. So these 11 years old respondent who have to carry this 30 kg almost every day, or 30 to 40 kg actually. We also want to know whether they are suffering from any other respiratory problems or skin problems. And we found that 54% of the 53% of the respondent mentioned about respiratory problem, and 92% of respondents mentioned about skin related problems. And one of the respondents, that is female waste recycler, mentioned that when I clean medicine gallons, I have struggled for breathing from the toxic gases. So the struggle intensifies when I have to clean gallons for different types of medicine. And we also want to know the prevalence of injury, and 78% of the respondents mentioned that they about cut problem during last 12 months. And here are the picture where the respondent shared their injury problem during the data collection period. And we also want to know the effect of pandemic on the employment and daily life. So only 24% of respondents mentioned that they are unemployed during the pandemic. But almost all of the respondents said their earning did not decrease a little, because the waste management sector is a sector that is the lockdown didn't affect this sector actually. And from the study findings, we want to recommend that we found that occupational hazards were mild among the child waste worker, obviously, and children involved in waste management are they are involved in this sector informally. So typically, they are excluded from the mainstream child protection and support system, making them more exposed to occupational harassment. So policymakers should design specific program for this specific vulnerable population actually, and they should provide the protective equipment, and as well as ensure the access to healthcare and provide basic nutrition to them. Furthermore, children should have also access to basic literacy education for their future development. And finally, but certainly not the least, government should think about the income generating programs for this group of children. And here is a picture of our research team. Professor Jahidul Gayam supervised the whole project, and Ansur Rahman Bayajid and Monibur Rahman also involved in this project. And thank you, everyone.
Thank you, Hasna. Thanks for keeping time perfect. We have 5 minutes for questions. Who has a question? Otherwise, while people are thinking about their question, I might have one for you. Prashi, please go ahead.
Hi, very nice presentation. I have 2 questions. One is that how are these children recruited? Because like, for example, in India, they are recruited through local ward officers, or local municipalities have a role. So how is the recruitment happening for these children? And secondly, after COVID, were they also engaged in recycling of medical waste? Or did you collect data for whether they were involved in treating or dealing with medical waste? Just thank you.
Thank you, Prachi. Thank you for the question. I also want to mention about the data collection process and also discuss about Lorenzo and Lauren during the data collection. It was really challenging for us since city corporation didn't recruit these children. These children were recruited by the third party. And since in the Dhaka waste management system was run by a third party, I mean in secondary transfer station, city corporation did not recruit any children. So when we want to recruit these children, we have to struggle a lot actually. The secondary transfer station, the owner of secondary transfer station, or the manager who involved in with the station, they say that there's no children working in the spaces. And they also mentioned that no children, or they will not recruit any children actually. But we see a lot of children work in the spaces. So we have to struggle a lot. We have to convince them in a different way that we want to manage something for these children actually, and we also want to do something for them. And we have very bad experience in some cases actually.
Well, keeping on like Prashi's question, so you said there is no like policy, public policy, like protecting these children, and I was wondering, like, how have you started to approach like local public deciders that could have an impact on this particular situation, or the private sector, people from the private sector that are responsible for this situation? And do you already, or is it part of your research, or do you have ideas on how to, what a policy or, you know, agreement could look like that would protect these children from this situation?
Yeah, it's actually in my, I was involved in another project funded by Wellcome Trust. We also worked about the waste management scenario of Dhaka City. Here, when we have, and we have done a comprehensive policy analysis in waste management system. I mean, for the waste management policies in Dhaka City. And then we found that there is a policy for the waste management, but since these are informally recruited, there is no policy for the children involved. No policy mentioned about these children actually. So, and we also, during the KI, we also wants to know why, what can we do for these children among the, we also ask about our key informant about what can we do, and they also suggest something about this. So from based on that analysis, we recommend these in policy analysis. We recommend these to policymakers actually.
Thank you. There's a question in the chat for Guy. Could you shed some light on the role of NGOs, if any, involved in helping the children out? As you also said that children lost education during COVID-19.
Yeah, thank you. Thank you. But during our data collection, we didn't find any proof that they mentioned about they get any support from the non-government organization. Obviously, non-government organization helped a lot of children, but somehow these are floating population, and these are actually sometimes this is really difficult to contact with these people, and but we didn't find any respondent who mentioned that they get help from the NGO. Maybe we should focus on that aspects also.
I think it would be a good idea indeed to map the universe in which this is taking place with like stakeholders, those who hire these children, those who regulate this, like, waste management system. There must be a regulation, even though it's not maybe implemented, or and the NGOs working and see where and how to you might have some leverage to improve this children's situation. Do you have an idea of the rules, the policies in place, and what policy, what regulation are supposed to be applied that are not applied here?
No, I didn't. When we are looking for the implementation gaps of policy, there are policies actually for the waste management system and also in the labor force survey, but there is no specific or policy for the children who especially involved in the waste management sector. And also there is a problem. I think the main problem is that we should there's no data on waste on the child waste worker, since no one wants to agree that they hired or recruit the children as waste management sector. But this is the kind of first study where we try to document, or we try to identify that a lot of children involved in waste management sector. I also want to share these findings with our stakeholder. As all of you know, the DRAC has a better large connections, and we have connections with the government stakeholder. We also want to share these findings with the stakeholder, and we will try to share the message that we should focus on these vulnerable population.
Okay, thank you. Does anyone have a question? Anything? I think, Audrey, the floor will be yours. Thank you, Hasna, very much for your presentation and the work you're doing to shed light on the topic that where data are lacking and where people have failed to look at the problem. So that's an important work you're doing.